Welcome to another episode of Medicine Simplified. In this video, we will know how to calculate pediatric dosage by weight using Clark's method. In previous video, we learned how to calculate pediatric dosage by age using Young's rule. To watch that video, click on link in description. Clark's rule is an equation used to calculate pediatric medication dosage based on weight and known adult dose of medication. Weight should be calculated in pounds or should be converted into kgs. 2.205 pounds is equal to 1 kilograms. Coming to the formula of Clark's rule, weight divided by 150 pounds into adult dose, which gives to pediatric dosage. If you are calculating in kilograms, weight divided by 68 kgs, which is 150 pounds, into adult dose, which gives to pediatric dosage. We all know that 2.205 pounds is equal to 1 kilogram. 150 pounds is equal to 68 kilograms. Let's see it in examples. First example is, if pediatric patient weight is 30 pounds, which is divided by 150 pounds into known dosage of medicine is 500 milligrams. After division, it gives to 0.2 pounds into 500 milligrams. Recommended pediatric dosage is 100 milligrams. Now we will convert it into kgs. The weight of pediatric patient is 12 kilograms, which is divided by 68 kilograms into 500 milligrams, the advised adult dosage of medication. After calculation, 12 by 168 gives to 0.176 kilograms, which is multiplied by 500 milligrams, which gives to 88 milligrams. So recommended pediatric dosage based on weight is 88 milligrams. Coming to the concern based on weight calculation, we should consider other health issues like juvenile diabetes, obesity, and the severity of disease. Depending upon severity, the dosage of medication can be increased or decreased. Developmental disorders like GI related developmental disorders. Type of medications, like some medications are hydrophilic or lipophilic. So dosage varies in hydrophilic medications and lipophilic medications. If you like this video, please subscribe to our channel. Thank you.